Our interest is treating the brain and the spine. The issue for us, how to keep the patient functioning normally. St. Catherine has a very leading role in the community. I actually call it one of the best kept secrets in Long Island. It's a very good hospital, very caring. I say sometimes that everybody knows how to operate. What distinguishes St. Catherine is the compassion that the staff have and the quality of care we give to our patients. One of our success stories, which there are so many, is Dr. Olivia Valley.
I am a chiropractor for 22 years. I also do figure competitions for about 4 years. I'm very active. I do marathons.
One day, she called me and said, I want to see you. I can't move my arm. I'm in so much pain.
I actually got into a little fender bender on the way to work. Everybody was fine. That evening, I started having numbness and pain down my arm. It was very painful. And after 2 or 3 days, I started losing grip. I couldn't even adjust my patience, and I couldn't even work out at the gym. I was not able to hold on to anything. I came to Dr. Shady actually just for him to review my MRIs, and he had told me that it was serious.
I look at her MRI, and she has a disc herniation pushing on the spinal cord and her neck and the nerve going down to the right arm. She was really weak. I mean, generally, she's a very strong, well-built, active person. Now she's weak, sensations going, reflexes are going. She cannot move her neck, and she's in agony.
And of course, being a chiropractor, I really need to have my strength and be able to move without any pain, so I need the strength behind my arms.
Being the doctor she is, she tried the conservative treatment. It's not helping her. And she is at the end of her rope. Help me out.
I've been friends with Dr. Shady for years. He's always helped my patients, and it seemed to be that I needed his help.
We decided we're gonna go for surgery. And obviously, which hospital would give her the best quality of care? It was clear it's St. Catherine.
He showed me what the procedure would entail, and that the procedure would only be an hour and a half, and that I would be able to go home that afternoon. My biggest concern was to be able to go back to my normal routine and have no scars. He reassured me that everything was going to be fine.
Usually when you operate, you need enough room. So when you make a small incision and you have a small field, you have to be really, really meticulous. I used less than 1 inch incision, and I was doing 2 levels, so it's not just 1 level. Obviously, this comes with experience. She did really well. Surgery went fine. It didn't take long, because one of the strengths we have in St. Catherine that we have a team. It's like an orchestra. Everybody is doing their part. So things went really well. The first question she asked, how small my incision is. It's not how big my incision is, how small my incision is. Her pain was gone. Woke up from anesthesia, recovery room, she's fine. She's home. A couple of hours later.
Immediately after the surgery, I realized that I had 80% of my strength back, and I had no pain. And I knew that the job was done.
Our goal is not to just operate. Our goal is to take the patient back where they were before the illness.
He suggested that I come back to him in 2 weeks, but to rest. And knowing who I am, he told me that I could go back slowly to the gym. And I did. 4 days later, I went back to work. I adjusted my patience, and I was able to start training again for my figure competitions.
She's back to the gym, and she is back to her competition in June. I think she's going to win, and I'm going to be there.
I've had a professional relationship with Dr. Shady for about 22 years since I've been a chiropractor. I've always had faith in him, and when I needed someone, I couldn't think of anyone else to go to, and he helped me. He gave me back my life.